Jen and I attended this hearing last night, Moses Lake, Washington. And we felt like the roller coaster of emotions that happened in this hearing was live stream worthy. So this is something that y'all need to check out too. I suggest anybody who's watching this stay for the whole thing so you know what we're talking about.
Yeah, this was like the perfect example of how city council members should handle a discussion and how government should work.
Yes.
And this is like my top 5. I mean, I thought about this all night last night. But yeah, me and Misty, and it was late. I didn't get up. It was midnight my time by the time it was done.
Yep.
We didn't know we could sign up for it.
Yeah.
So we were freaking out because we kept raising our hands and they kept putting them down. We just wanted to say our piece, but it was amazing. So, yeah.
Yeah, it sucks that we didn't find out till after the fact that we were supposed to sign up to submit public so that you could testify before 3 p.m. that the day of, but that's okay. That's okay. Wait till you guys see this hearing. It is just Ooh-wee.
Yeah, I honestly, I thought about we should just play our facial, the ones that the one we recorded or whatever. I'm like,
Oh,
because I know, if we went back and watched that, we were like up and down,
uh-huh. Uh-huh.
and like towards the end, just like, oh my god, I can't. I was like, I can't take it anymore. Oh man.
No, this is this is like one of those movies that have so many twists and turns in it.
Yeah, and you're like, just hurry, dude. I can't stand suspense movies. I'm always like, I just can't watch this anymore. I'm just gonna get up and leave. I can't watch it. Tell me when it's over.
This is one of those.
Yeah, this was totally one of those. Like I felt like just
But
yeah,
we stayed late. It was 11 p.m. my time. Anytime we watch these hearings that happen on the Pacific Coast time, it is late. It is our
but
time.
this one usually they're totally not worth it. But this one, 100% worth it.
Yes, totally. Okay, I'm gonna put the ticker on there so that when people come in, they're like, "Oh, which hearing is that? What are we doing?" Okay, Moses Lake, Washington, 7/14/26, right? Yes.
Yeah.
Okay, I'm gonna add that on there.
And I'm gonna share. I just realized I didn't even share this out.
Oh yeah, we gotta share it out. Let me go do that too.
Uno momento, por favor. I usually say it really country. Uno momento, por favor. All right, let's see.
Grassy ass.
Grassy ass. I'm gonna have to start saying that shit. Grassy ass. Okay, let's see. Moses Lake. Every time Allison has to go to one of these things in person, it's always late night and it's always like hours long.
So many hours.
At least this time, I feel like Allison, she saved the day. Because she was really the only person up there.
She sure was.
I just feel horrible that we did not know.
To sign up early, yeah.
Yeah. Okay, there we go. There we go.
I'm still sharing it out.
I gotta go on the Book of Faces here. I feel like that's a Game of Thrones. Did you ever watch that?
No, I never have. Oh. When people reference it, I'm just lost. I'm like, what?
Okay. Dude, it's good. Like I remember I didn't watch it till it was into, I think almost like halfway through its like 3rd season. And I went and watched like the 1st season and I told my brother like, dude, you gotta watch this. And so we ended up watching, and then I told my husband like, dude, you gotta watch this. So like, I got everybody hooked on it. It's really good though. For me to sit through that shit, like hour-long episodes, it's gotta be good. I usually cannot sit through stuff like that. Okay, let's see.
You know what Moses Lake did is what Spokane Valley should have done. It's what Spokane should have done. It's what those other ones,
It's what
you know.
Tennessee should have done.
Yeah. It's what Kansas should have done.
Yep.
Connecticut.
Like this, whoever these people that were elected into this position, this is literally what city council members should do.
Yeah.
Hey, Bunny.
Hey, Bunny.
Hey, honey bunny. Yeah, this is just, I mean, I was just, man, and I was trying to explain it to my husband. But, you know, if you don't sit through city council meetings, you don't really, like, get it.
Mm-hmm.
I was like, let me just say it was really good. Okay, so replay from Moses Lake, Washington, 7/14/26. And dude, I hate how I'll try and like type and it always does the letter next to it.
Mm-hmm.
Oh, you love Game of Thrones? Dude, Game of Thrones. I mean, I love Game of Thrones. I was pretty sad when it ended. I love Tyrion, the little dude. He's cool. I think he's my favorite character, Tyrion Lannister. Because he's I don't know, you'd have to watch it. One of these days, Misty,
One of these
when all
days.
these bands and shit are over
I know.
you gotta watch Game of Thrones.
I'll stay up till 11 p.m. watching Game of Thrones.
Yeah. Exactly. That's how life should be. That's how, when you can live a free life, you know?
That's how life was before 7OH came out.
Yeah, exactly. Yeah. When we weren't shackled.
Yeah, shackled to the hearings.
It'll be better one day. And we'll have earned some freaking stars to add to our. You know what, Bunny? I watched, I think 2 episodes. I don't know. It's just, you know, like when you watch a really good HBO series and then they have like a spinoff and it's like not as good, like the quality. It's just like I don't know, like a generic version of it, I guess. And I just couldn't get into it. So I don't know. I did give it a try, but I just can't get into the House of Dragon. Is it still going? I thought they had canceled it. I could be wrong though. I might be thinking about another thing. I don't even watch TV. It gets better. I'll have to check it out. I'll have to do that. That'll be on my list. Because I will power through it if I know it gets better. Oh, my poor mom. She's going to the vet now.
Oh man, I know when I read that I was like, oh my God.
Oh, I just can't imagine.
But she's making the right decision.
Yeah, I mean, 15 years is a good life for a kitty.
Yeah.
Dude, if anything happens to my cat, I can't make it.
Is that her only cat?
She's got 2 other babies. Like, you know, they're like a year or 2 old. So,
Mm-hmm.
But, you know, that's been her right-hand man for 15 years. So, but it's sad. It's just, that's why I can't stand thinking about getting another dog because we've had to do that with 2.
Oh, I know.
And I'm done. I can't do it.
Every now and again, we'll toy with the idea of getting another dog, and then we're just like, it brings us right back to when we had to put Hazel down, and it's like,
Yep.
nope, we'll just get fish.
That's
Fish eye, who cares?
Exactly. It's like I can't do that again. I just can't. Like watching it, having to take care of like a dog when they get really old and you know lose their teeth, and you know it's just it's sad. All right, so let's go ahead and get this party started. Let's watch how your city council should do things.
Yeah, it's gonna be a roller coaster of emotions. Just
Yeah, Just trust us, sit back, and enjoy the ride.
It's worth, what is this, an hour long? It's worth the
Yeah,
hour.
it's right at an hour.
Next up, we have new business, item number 7, which is Kratom regulation options. And here to present this evening is our city attorney, Catherine Kennison. Catherine?
Thank you, Mayor and Council. So before you, you have 2 different versions of potential ban on kratom. One would be a total ban regardless of age and type of product. The other would be a ban just on kratom being sold or possessed by those who are over the age of 21. And there's been some discussion
Can you
about
take a zoom in?
trying to carve out an exception for the natural product as opposed to the product as it's been altered with synthetics or
Yes.
additives. And staff's position on that is that would be very
That looks much
difficult to
better.
enforce. And so we don't have the technology to test kratom and kratom
We hear
products
this
to
all the
identify what
time.
is in it. It's not something that our enforcement staff is experienced with. So if that was a direction the council wanted to go, we would want to explore a little bit more what that would look like in terms of the equipment or tools staff would need to acquire and able to in order to be able to determine what product they were dealing with. And same with the age. You know, that's going to make it really difficult for, it's not like we're going to do stakeouts at the Airway Deli and see what they're, you know, selling and to whom. So when you look at it from an enforcement perspective, if the desire is to ban it, then the easiest way to ensure that that is being enforced is to ban it totally until the state decides whether they're going to step in. And we would expect the state to revisit the Kratom Consumer Protection Act that was presented to the legislature this last session. That we expect that to be back this year. And if they adopt that, that will preempt our local regulation.
Okay. All right. We do have several public comments on this topic, which we will go ahead and entertain now, beginning with Susan Eppard. Susan? Oh, Susan, are you online? I'm sorry.
I'm sorry, Arlette.
Yes, I am. Can you hear me?
We can.
Yes, my name's Susan Eppard, and I would like you
I
to
mean, it's
ban all
awful.
forms of kratom. My son died in 2021 from all natural.
Sorry, Miss Eppard. Would you please provide your city of residence for the record?
Yes, I am from Muskegon, Michigan.
Okay, thank you.
Yes, and my son died at 22 years old from all natural whole leaf kratom powder. He died back in 2021, back before synthetics hit the market. There was no semi-synthetics nor synthetics back in 2021. They didn't hit the market until 2023. I'm familiar with a lot of other people, parents, and other people who have lost loved ones to just the all natural whole leaf kratom powder, which is the precursor to all the other semi-synthetics. And without them, there would be no 7-hydroxymetragynine, there'll be no metragynine pseudodoxil, or the other products that are just like morphine and more potent than morphine. So without getting rid of the powder or the leaf powder metragynine, you're not going to get rid of all of the problem. So while the federal government is going after 7-hydroxymetragynine and other synthetics, the main problem is the precursor to all those drugs. And my son's toxicology and autopsy showed he died strictly from metragynine toxicity, an alkaloid found only in kratom leaf. And it caused him to have a seizure, go into cardiac arrest, and die on his kitchen floor in front of his girlfriend. And he had, according to toxicology, had no other drugs, no prescription, no street drugs, nor alcohol in his system. And his autopsy showed he was perfectly healthy 22-year-old young man who should have lived out a full, long life. And he had never had any health problems his whole life. He shouldn't have died. He had no way of knowing. They advertised this product as a safe, healthy coffee alternative, and he had no way of knowing that it would kill him, and he became addicted to it. He couldn't stop taking it. It would give him shakes if he tried to stop taking it, and this was the whole leaf kratom powder. This was not any of the synthetics or semi-synthetics. And I just implore you to save other people, because every time I have to hear another mother and father or anybody lose a loved one to this garbage drug, this gas station drug, they don't sell it out of GNCs. They don't sell it out of regular stores, just shady gas stations, convenience stores, and smoke shops. That's all they don't, that's all they sell it at. It's not a, they, insurance companies won't even insure them because it's just a dangerous drug. And all the way around, it just needs to be banned. And I implore you to ban it, to save other people from living a life of misery that I'm in. Thank you.
Thank you very much. All right, next up we have Amy DeLuigi.
Amy DeLuigi, Moses Lake, Washington. I was the first person to present this to the city council months ago, so I'm actually really astonished it took you guys this long to take action. So I like to see more people being more proactive versus reactive in regards to public health and safety. I'm also going for a full ban, and I'm here to educate a little bit harder because there's still major confusion between what kratom is and what 7-OH is. I actually been investigating this once again with Sean Ryan and Steve Robinson for 5 years. Sean Ryan owns the largest podcast, XDEA, and he also is big on corruption. Steve Robinson owns the Mainwire. We've been working with the I apologize. We've been working with legislation in regards to nationwide banning. So what is kratom? Let me just differentiate between the two. Kratom is the natural plant from Thailand, and it has traces of 7-OH in it. Is 7-OH dangerous? Yes. Why is 7-OH dangerous? 7-OH is dangerous because it bonds to the opioid receptors and it responds to Narcan. It is an opioid that is 10 times stronger than morphine and has 10 times the affectability on the human body. As I made this presentation before, it will kill a baby inside of the womb and due to the toxicity. We have an issue, you guys. It also depletes the nervous system, the bones, and the muscular system within 2 years, which takes morphine 10 to 20 years. We don't have time to not ban it in completeness. The reasoning why, it's the same presentation I gave to Othello, who took affirmative action in less than 24 hours. Ken Johnson's an amazing mayor over there who sent people out immediately within hours of me identifying this. He identified it almost the same day I identified it to you guys after I realized that law enforcement didn't know what it was. So what is 7-OH? 7-OH is a lab form. We can't just ban kratom, you guys. We have to ban kratom and 7-OH. And I am going to cue you in because I'm probably one of the most educated parties in Washington State. 8-OH and 9-OH has already been made, you guys. If you don't ban all future derivatives, you're going to do the circle jerk again. And that's what the country that made this is highly aware of what it takes in legislative power to have to re-ban something. And every time it gets banned, they add the hydrogen molecule to it to change the recipe. So if we're not hyper focused on all future bans as well, we're going to see the same reemerging issue. So we have to take this very delicately and we have to take affirmative action immediately. My friend works at the ER. She's actually a doctor in Colorado. They are seeing thousands of people coming in, and we don't know to date how many people have died of this because nobody knows about it. You know, I came in here this
same day I realized that Juan Rodriguez had no clue what 7OH was. He pulled someone over on my lot and wanted to have a conversation with them, and he wasn't aware. And that night I was in here at City Council because I realized, oh my gosh, law enforcement didn't know about it. I came and talked to Sands, and Sands wasn't aware of it either. So we have a huge problem that not even people in our drug task force understand what this is. Why do we need to go for a full ban? Same thing that I'm going to tell Othello. What can we do with amphetamine? We can take an allergy pill, and it doesn't take rocket scientists to start extracting that out and making methamphetamine with it. We can do the same thing with the kratom plant. And until we understand this beast, I've understood it for 5 years. I'm actually shocked that nobody in Grant County, including the health department, actually was educated on this. This is crazy, you guys. It was already in the school systems. I was already proactive out there, letting the coalition know that we need to start educating parents because they were already selling it in our school system. So I'm happy that this is happening today, but a little bit appalled that it took you guys this long. I presented this to you guys a while ago, and honestly, the only person that's even walked through my doors in regards to public health and safety is Mr. Lombardi right there. And I paid him a lot of respect today, because when it comes down to public health and safety and the seriousness of taking avenues to actually protect consumers, that guy right there was the only guy that walked through those doors and handed me phone numbers. Not one of you guys even cared to question me. I'm the leading specialist. Cannabis is my forte. To be inside this arena and understand these things is a must for me. So I am very happy that you guys are doing this, but I'm very disappointed it took you this long to do so. I had cities that did it in an instant. So I am glad that you guys are doing this, and I'm going for a full ban. We need a full ban. We already have opioids out there in the market that are controlled, that are not doing this type of detrimental damage. Just as damaging the human body. Let's protect our people.
Thank you.
Thank you very much.
Next up, we have Allison Smith.
Nobody knew about it because it wasn't a problem.
Exactly. Here comes Allison.
Ali.
You know, I do this for a living, and it never gets easier talking to people. I always get so nervous. Just give me one moment. I'm sorry. Okay, here we go. So hi, my name is Allison Smith. I'm the Director of Government Affairs for the Global Kratom Coalition. I have sent a few of you guys emails, and I had the opportunity to speak with a few of you this evening.
Ms. Smith, real quick, city of residence for the record.
Oh, yes, I live in Washington, D.C.
Thank you.
Thank you for allowing me the opportunity to speak tonight. First, I'd like to thank you for taking this issue seriously. We all share the same goal, protecting public health and making sure dangerous products are kept out of our communities. I also want to acknowledge the work of the Grant County Health District, her health department. While we may not agree on every policy recommendation, I appreciate the health district's commitment to protecting residents. We believe that there is an opportunity to take a more targeted approach than a blanket ban. Over the past few weeks, the regulatory landscape has changed significantly, with the U.S. Drug Enforcement Administration announcing its intent to temporarily schedule concentrated 7-OH, 7-hydroxymitragynine, commonly known as 7-OH, along with several related synthetic derivatives as a Schedule 1 analog under the Controlled Substances Act. Importantly, in that NOI, Notice of Intent, the DEA did not propose scheduling traditional kratom products or its primary alkaloid mitragynine. The agency specifically and clearly limited the proposal to 7-OH above a certain threshold. This distinction is significant because it demonstrates the federal government's recognition of the difference between the two products. 7-OH is not a traditional kratom product. They are highly concentrated, lab created, and have become increasingly available and have raised legitimate public health concerns. Federal agencies are already regulating this. The DEA exercised its scheduling authority and expressly excluded natural kratom, as we know, and we believe that local governments should follow their lead. Rather than prohibiting all products that call themselves kratom, we encourage the city to consider policies that specifically focus on these novel, concentrated synthetic products that are causing the harm that you're seeing and reading about. natural kratom leaf, which has been consumed by Americans for more than 50 years, is, as we know, safe to consume. But this approach aligns with federal regulators that are talking and allows enforcement resources to be directed at the products that are causing harm. I apologize, I lost my spot. Natural kratom is a different product. It has been used for generations from Southeast Asia. Over 23 million Americans consume it today and have for decades. Whether one supports or opposes its use, it is important that policy distinguishes between these two products. As policymakers, your decisions are strongest when they're based on the most current information available. And since many communities first began discussing kratom, we've seen a significant development at both the federal and state levels, and that information deserves to be part of the conversation. Before adopting the ordinance, I respectfully ask the council to take the opportunity to learn more about these differences. Prior to this meeting, I did reach out to offer educational presentation, and I want to extend that offer again publicly. I would be happy to meet with the council, city staff, the health department, anyone who is interested to learn more about what the DEA action is and what it entails, the differences between natural and concentrated synthetic products, and regulatory approaches that are being considered across the country at the federal, state, and local level, with populations varying from 700 people to 40,000 people to 200 million people. My goal is not to tell you what decision to make. It's just to ensure that whatever decision you make, it is based in fact, science, research, education, and what we are seeing across the country. I'll try to wrap this up now, but if you have any questions, I'm more than happy to answer them. And if I can't answer them, I will find the resources to answer them. Thank you for your time.
Thank you.
Any questions?
Deputy Mayor Myers.
You mentioned that the DEA was working on scheduling it as a class or a Schedule 1
Yes. So
the concentrate.
7-hydroxymitragynine is a concentrate. It's whenever you concentrate it above a certain threshold, the industry standard is 2%, which are these high potency products. They're usually like pills or like gummies that you see in gas stations or convenience stores. Those, along with other variant synthetics that I'm blanking on the name off the top of my head, there's about 3 or 4 others. The DEA has announced, it was July 6th of this month, that they are intending to add that as an emergency schedule to the Schedule 1 of the CSA.
Do you know how long that takes to take effect?
30 days, August 6th, I believe is when it should go into effect. And then it'll be on the schedule for at least 2 years while they review evidence to determine whether or not it deserves permanent scheduling or to be removed.
Councilmember Skog.
Other than a label, how would anybody distinguish between the two?
So fantastic question. So what we do at the local level, and a lot, this is prominent usually with KCPs at the state level, is we encourage certificates of analysis, or COAs. And what they are is it's a third-party lab that tests these products to ensure that they are not contaminated with any types of metals, stuff that it's not supposed to, not human individuals shouldn't be consuming in general, as well as 7-OH and any of these other synthetic derivatives. I've worked with a couple of individuals. We have what's called a municipal manual, which is basically a watered-down version of the KCPA, Kratom Consumer Protection Act, because as a locality, we don't have resources to what's available at the state level. And that has a list of how to implement those regulations and what specifically how you can implement COAs with verified labs that can't just be bought and paid for. They're going to give you legitimate COAs and make sure that they're in compliance with local, state, and federal regulations.
Does anybody oversee the labeling?
I
mean, how do I know that somebody has a label on something?
Oh, yeah. So DSHEA, the Dietary Supplement Health and Education Act, is a federal law that requires all dietary supplements to have accurate labeling. When you lie on the labeling packages, you are breaking federal law and therefore subject to federal and criminal punishment. And that's actually one of the big reasons why there's been such a push at the federal level, is because you are creating 7-OH. The 7-OH industry is creating these concentrated synthetic substances and labeling themselves as quote unquote kratom when they are not in fact kratom. They are as close to kratom as ethanol is to corn. Like there's no pharmacological or chemical similarity in that way, or the way they impact you. And so that's what led to the scheduling as a way to get rid of those products and off the shelves. Does that help answer your question?
Yeah, but I just wonder who would be overseeing that And how are they going to search every gas station, mini store and say your label is correct or your label is legit?
I mean, I would assume it would be similar to the way you implement tobacco and alcohol regulations. Cannabis is legal in the state, correct? So that's very similar to that. I'm assuming you guys don't go door to door and knock down every single product. That's not an efficient use of your time. You probably go based off problematic stores or issues where you've received complaints from. So I trust you guys and how you've implemented regulation on other controlled, or not, I shouldn't say controlled, but other substances that deserve regulation on how you want to implement that. And I'm happy to discuss that more with you on what would be most effective.
Councilmember Davis.
Thank you, Mayor.
Mhm.
Is there any movement on regulating the location of distribution of these, similar to marijuana here in the state? Alcohol, it used to be liquor stores, but marijuana is highly regulated as far as where it can be distributed from. Is there anything like that for Kratom
At the top of-
pipeline to slow it down or make access to it more difficult for the younger population?
So off the top of my head, there were a couple of bills that were proposed at the state level regarding regulation of varying levels of what that regulation looked like. With the DEA scheduling, I'm not quite sure how that's changed the platform. I handle localities, but I'm more than happy. I can connect you with my colleague who does lead state policy, and he is a wealth of information on that. That being said, if you're talking about localities, I think there was an individual I spoke to talked about there was Kratom products for sale right next door to his elementary school or school. We support zoning ordinances that limit the sale of those products from that. And I emphasize that we want strong regulation on natural Kratom products. We're happy to comply with that. We just ask that you reconsider potential blanket bans, given that the impact that it could have on the individuals who do consume natural kratom.
All right, thank you.
Thank you. Have a nice night, y'all.
All right, next up we have Matt Pollock.
If I could make a request to go last, since I can offer a board perspective from the Board of Health to the council, so I can address anything that comes up. Is that okay?
I think we have one more.
Oh, is it just Reese? Okay,
Yeah.
we're good. You guys have heard me before. I know that there's kind of a push to kind of make a distinction between natural and synthetic kratom. It's too messy. It's way too messy. Like nobody checks what's in the pills. Like even if there's a certificate of I forget what you said, but if they send it to a lab, how are you guys going to know that that lab is not just taking money and saying, oh yeah, it's good, this is what's in it? Like that can happen all over the world. You shouldn't be expected to know like all of the science of this. Like you're not a health jurisdiction, but what we can tell you is that this product's dangerous. Derivatives of this product are dangerous. We need regulation around substances that can cause addiction. Kratom's one of them. So we even need the federal government to come and say, okay, we're controlling this this way. Like put Schedule 1 on 7-OH is fine. Anything else they do with the natural leaf, that should be decided in a healthcare environment with doctors and research scientists, not by local cities. But we know that there's an emergency with people starting to use it. Reese is going to share some data about overdose deaths that is pretty shocking. We know people are addicted. We know that you reverse it with Narcan. We know it's opioid related. That's kind of enough to say, well, and then the other thing is there's no approved medical use for kratom. So if we're going to say, oh, you need to keep it for people for this benefit, well, there's no proven benefit. Like there's no approved benefit for use for any medical condition. Even on the packages, every supplement says it has not been evaluated by the FDA to control, treat, diagnose, or prevent any disease. So that kind of should make the argument done, because nobody's like, they're not legally allowed to claim that it does that because it's not evaluated by the FDA. That's all I've got, unless you've got questions.
Thank you for your time.
Yeah.
All right, Mr. Reese Levitt.
As Matt said, it's just Reese. That's not that important. But no, my name is Reese Levitt. I work at the Grant County Health District. I reside here in Moses Lake. And I did provide, I think everyone got some of the materials. I can start off with the CDC report. It's from March of this year. And it's talking about the kratom related reports to the poison centers. They monitored this for the last 11 years from 2015 to 2025. And they received 14,449 kratom exposure reports. And that doesn't sound like a lot, maybe over 10 years. But the record high was 3,434, and that was in 25. And that compares to 258 reports in 2015. So it's a 1,200% increase of poison control center calls from 2015 to 2025. The hospitalizations for single substance kratom exposure also increased 1,200% from 43 in 2015 to 538 in 2025. And then multiple substance exposure reports, which is just, if it wasn't just kratom found in the blood test toxicology reports, that also increased to from 40 to 549 from 2015 to 2025, which is a 1,300% increase. I'll try not to bore you with all the data. I mean, we all love to look at CDC reports, I'm sure. But this report doesn't distinguish between kratom and the synthetic 7-OH products, but 7-OH and the other synthetic products are fairly new. And so this report's just looking at any kratom. So it could be the natural leaf, it could be 7-OH or both. So one of the other points I want to bring up is that the national survey data among persons aged 12 years or older demonstrate that although annual kratom prevalence was stable from 2019 to 2023, lifetime use increased from 4 million to 5 million persons, indicating that more persons are trying kratom. And that just kind of goes to the public health aspect. As we all know, there's lots of substances, whether that's nicotine, marijuana, alcohol, or street drugs, or prescription drug abuse. This is something that hopefully we can get ahead of, looking at it from a public health perspective. It is worrisome. The FDA, the report came out last July. They tested it on rats, and it was more potent than morphine. I should have brought that report for you guys as well, but if you Google FDA kratom report, you should, I think it was July of last year. Basically, they administered 7-OH, which again is the synthetic version of a naturally occurring substance, to rats, and then they also gave those different set of rats morphine, and then they put their tails on a hot plate, basically. And morphine wasn't as potent. 7-OH was more potent. It's worrisome. It is available, kind of like what Matt said. In an ideal world, yeah, we could separate everything. We could try to break it down. We could say, okay, yeah, anything over 2%, anything under 2%. But we can't ask the city to do that. We can't ask our code enforcement, our officers to do that. We've been doing retailer surveys and just looking at nicotine and tobacco products as well as kratom. I can say this, we're still waiting on the data to come in. It'll be in August. But just anecdotally, as somebody who's out doing those surveys, it is readily available. It generally doesn't just say kratom, it doesn't just say 7-OH, it's usually energy, or it looks like a 5-hour energy bottle, and it has something like that. And then right below, it'll say kratom, but it doesn't say, oh, this is 70% 7-OH, this is 2%, or this is just pure natural leaf kratom. And I'm almost out of time. But the other papers I gave you, this is from the National Institute on Drug Abuse, and again, the resources are there, but one of the concerns, again, going back to trying to distinguish between 7-OH or the other synthetic variants versus the natural leaf products, even if we said that, okay, we'll just ban any synthetic, it's still not regulated at any level in the federal level, at the federal level or state level or local. That's why we support this as the health district supports this. But they have found, researchers and regulators have found similar instances of contamination in many other products, in many kratom products. And this is something, just in full transparency, this is something that has happened in other herbal substances, in other herbal supplements. So there's a worry. Like I said, I'm out of time, but there is definitely a worry. The health district supports this. That's why we passed the resolution. Kratom is very accessible to kids. There's no age limit on it at the state level. We would support a full ban because we just don't want another substance out there that is easy for our kids to access. And like I said, it's in just about every gas station that we surveyed. And a lot of those gas stations are within walking distance of schools and homes. If you have any questions. Thank you.
Thank you. Councilmember Skog, did you have a question?
Are kratom users and cannabis users the same people?
There's no data about that, honestly. Kratom is a new product. Honestly, even with just going to cannabis was legalized 10 years ago, and we're just now starting to get data on users. Some people that use cannabis are going to use kratom, vice versa. There's no data on that. I will say, again, just anecdotal data. I was at the I did a presentation last September to the North Central Washington Behavioral Work Group, and there's addiction counselors, people who work with people who suffer from mental health and addiction, and they had many patients who were using kratom. It's not the most common thing out there, but it is people who suffer from opioid addiction. They are using kratom, or people who start with kratom and then turn towards opioids because it is actually cheaper to get other opioids on the street than kratom.
Did anybody think it helped them?
There are people who say that they use it for withdrawal. You know, they're dealing with withdrawals. They're trying to leave heroin, fentanyl, other things like that, and they say they use it. But as I think was stated, there's no medical use that's been approved by the FDA for kratom. Kratom has, and it's newer, maybe in 20 years, I can't say what's going to come out in the data, but as of right now, there's no approved medical use for kratom. So I'm sure you can find somebody that will say that, yeah, it helped them with their addiction, but you could also find people that would say they weren't an addict, and then they tried kratom and became addicted to kratom or 7-OH products.
Councilmember Fancher.
So, Councilman Scott, so your comment about, is it the same people? I don't believe it to be. Because of the ease of the ability to get it. I mean, yes, can a kid get marijuana? Yeah, I mean, unfortunately, there's still a market out there that's not, Amy leave? Not at the cannabis store, because there's age limits on getting cannabis, and you don't have that same situation here. I did a little study of my own, and asked a neighbor kid, 14 years old, to go buy a couple bottles for me. Just wanted to see how fast he could come back with them. And it was not a problem. And that's concerning to me. And I don't know what they would do to me. I didn't take them, but I was more interested in how easy it was to get. I wasn't in the building. I wasn't in the.
I can't speak to that. Just like I said, we've been doing surveys. Yeah, generally, and this is not universal, but generally it's right there in the front, usually in a little plastic, stand right above the candy. Sometimes it's a little further back, but usually it's right there on the counter. And it is easy to get. To what Councilman Fancher was saying with cannabis, yeah, is it possible that a kid could go into one of the dispensaries here and get cannabis? Yes, but if you look at the data, it's like around 1 to 3%, I think, of.
Well, it's that same person that could walk into Safeway and get it.
Yeah, it's much. It would be.
But
it's much harder to get cannabis as a youth than it would be
Right.
to get this product.
Right.
That's what my point
100%
was.
that's why I don't believe it to be the same. And because it's more available, it might be their, I hate to say it, drug of choice. That's an opinion of Mark's, not, I don't know for sure. And that's the concern, is the unknown is probably what I have. And again, this isn't, I think of marijuana, and what we went through to get to where we got with marijuana, and since then have had family members that some still with me and some not, that have used it in various, I guess, what you would say, medical reasons. And that went through a lot of heat and information, but any decision I make here is for the future, thinking about the next generations. I sit here right now and I have 5 grandkids, and I think about the availability and the invite that they have to taking it. Basically, like I say, it looks like candy, it looks like something fun, and that's my concern, is just thinking about how do we govern that, and the availability of it. I understand that there's something around every corner, and some may be perfectly fine, and then unfortunately they taint it, right? And so I don't know the right answer, but this is kind of emotional for me. One, to find out how easy it was for a very impressionable couple kids to get. I don't know if I set them up for failure now, meaning now they know they can go get it. But I did talk to their parents. But like I say, I'm concerned about this, and the more and more I find out about it, and now finally the federal government is getting involved. I just don't, like I say, and then I have to believe that I don't know how you police it. That's part of my structure, right? Deal right now too. So anyway, I'm not 100% sure, but I just want to say my piece about where I'm at on it. So.
Deputy Mayor Myers.
I'll just pick up where Mark left off and ask the police chief if the DEA does schedule this as a Schedule 1 drug or as an emergency, what does that do to the police department? How do you respond?
Yeah, so it'll then fall under the RCW and certainly can take some action. But again, we're right back because my understanding and pardon me if I misspeak from what she said earlier, but it is the 708 or the synthetic form. So we're back at trying to determine what is or is not the synthetic form, which again puts us in the same boat. I mean, to what we're talking about here, whether you ban it totally or you only ban the synthetic forms.
Going to the availability, if we just ban the synthetic, we could just go to the stores and say, hey, you got to pull this off your shelf. Get ahead of the game a little bit, because I mean, it's pretty good chance that it's coming anyways.
Sure, we can do that. I mean, but I guess my thing, and again, going back to the person from the association, it's been illegal to say that you're kratom if you're not kratom, and yet they say they're kratom and they're not kratom, right? So I don't know, it's the front loading, the education piece is the easiest. I mean, regardless of how or whichever way you take, it will always be the enforcement part that's going to be the most difficult.
Councilmember Graves.
Yeah, I think this is a hard one because I don't think that there's a perfect solution. I think that's what Councilmember Fancher was alluding to, that based on all the evidence that we have, it's the synthetic form that's the most potent, highly addictive, destructive potentially. So, but we can't enforce that. And so if you can't ban just the synthetic version of it, the question is, what do you do when you have such a highly addictive, substance that's marketed to kids, that's available to anybody to go and purchase? If you can't just ban one form of it, and the options are to not ban any of it, or to do a blanket ban, I think that it's
I would lean towards a full ban. And you know, ideally this goes to the state, you know, has some sort of they take up the, you know, the legislation and they get the Liquor Control Board involved so that it can actually be regulated and enforced in a way to where maybe the natural forms of it, which maybe not as, you know, destructive. I think that's, and if the state does pass legislation, it would preempt whatever we're doing today. So, so yeah, I mean, I think, you know, I take seriously when there's a substance that's available to anyone, that's marketed to kids, that's available to anybody. You know, we've seen our neighbors around that have passed full bans, and so I would lean towards a full ban first. I'd be okay with the 21 and over ban, and where I'm at is my third option is to do nothing, and I don't want to take that action. So I'd lean towards the option of a full ban, and I know that there's going to be unintended consequences, you know, but we're sort of having to make the best decision that we have with the information that we have with imperfect enforcement, and so that's where I stand on it.
Councilman Davis.
Thank you, Mayor. I, like Mark, have grandchildren. I have 12 of them, and I did not know, thank you for your unscientific experiment, that a 14-year-old could purchase this. That wholly is disturbing to me. I sympathize with Susan, who presented with it to us today. But I want to thank all of you who spoke out, to be honest, to be fair. This is a really difficult decision, as Councilmember Graves stated, and Councilmember Fancher stated. This is not something we take lightly as a council. But I would be devastated if I found any child purchasing it, saw it happen. I'd be devastated. I would be beside myself, and to know that the only way to counteract it is with Narcan is terrifying. So having learned from everybody that's presented here today, and talked to us about what they know from the medical, well, from a parent, and then again from the health department and Ms. DeLuigi, I thank you guys for presenting, and I am in the same situation where Joel is, or the same boat with Joel is. I would lean toward a full ban. We need our federal partners to work on this. We need our state partners to work on this. This isn't something I feel like should be left up to the cities to figure out. It's obviously a dangerous substance, simply because it can be derived so quickly and easily. So where I stand is a full ban, and then if that, at a minimum, a 21 plus, I would really like to see the state step in and say, this can only be sold at XYZ type, similar to a dispensary type situation, to limit the accessibility to it. But that's not something we can impose here. So until that happens, I'm in support of a full ban.
And I could just say very quickly, like you said, it shouldn't be up to the cities. Like, you guys shouldn't be the ones leading the way. It should be the state, in my opinion. But just as somebody who keeps track of substances and prevention and things like that, when cities pass laws like this, ordinances, it puts more pressure on the state to do it. And then they're able to do a more, they can do it obviously and preempt other laws, and it puts the responsibility on the state shoulders. That's one of the other reasons why we support this, is it pushes the state to move forward.
Councilmember Lombardi.
Thank you, Mayor. So I'll just give you a little bit about myself. I'd probably eat 50% organic food. And of that 50%, I raise my own food. So obviously I have a bias toward not putting chemicals in my body. The other 50% of time, you can only do so much when you're running around and you got to grab Burger King or whatever, or something at Safeway. the thing about this whole discussion is that it seems like it's too easy of a decision to just say ban this product without really thinking it through. And what I mean by that is everybody's focused on the action being ban this or not to ban this. And not one person, and I've spoken to a few other councils and I've had some deep conversations with them. Nobody's talking about the reaction to the action or the consequence. And that is if we ban this completely. So let's say, for instance, Othello's done it, Ephrata's done it, now Moses Lake has done it. That's a nice pathway for the drug dealers to get into this trade. Because clearly there's a market. And that's my biggest concern, is that the drug dealers get into this business and make it even more addictive and put the worst chemicals in it, because they can't do it really if there's a small market. But when you start building a pathway, then all of a sudden they will get into it. And that will cause the police department more problems, because that's another drug that's going to be worse. So that's a big concern of myself. So for me, I'm leaning on a 21-year-old, making 21 and over only, because at least we know with alcohol and liquor and cigarettes and marijuana, that has some effect of limiting it. And it'll make it much, much harder for children to buy it. And if we don't think we can enforce that in this city, then we might as well just say anybody can sell alcohol, cigarettes, and everything else, because those are very bad. If you look at all the addictive products that are intentionally put into a cigarette, it's incredible and how harmful it is. And again, it's not just the reaction. The bigger problem to me is the want. And, you know, humans, we can't stop that. We can try preventive, discussions with them, show them a lot of different things. But for me, I would be only in favor of the 21. I think that's the only thing that could slow this down. At least we know that the children won't have access to it that easily. And and if somebody's over 21 years old and is doing this, they're an adult. So that's where I'm leaning, is the reaction. That's my biggest concern, is that we give the drug trade another tool to poison our children and to poison the rest of society. Thank you.
Thank you, Victor. Deputy Mayor Myers.
I agree with Victor. I'm not a fan of a blanket ban. Regardless, the feds are prepping to do something, but we can get ahead of it a little bit by doing something to make it a little harder for access. And I think that's the biggest issue that we're dealing with. Prohibition didn't stop alcohol sales. The drug warden hasn't stopped drug sales. Fireworks ban in the city limits doesn't even stop fireworks in the city limits. So I think Victor's onto something, and we should consider that.
Councilmember Skog.
I think Victor brought up some good points. It would be real easy just to say, let's ban it. Just for the record, I'm not a big fan or trust that the FDA, when it says something is of no medical value, I think they've got some experience in the last 5 years of proving them to be wrong. So I'm not willing to take that as the science. I think that to have access for 14-year-olds is wrong. I don't think 14-year-olds have the capacity to make good choices about that. So I think that, you talk about making it stronger, more potent. I mean, the whole cannabis industry has done exactly that. So I mean, it's this progression that always seems to happen. I would probably be in favor of not a total ban, but would be in favor of a 21-year-old, that it can't be bought by a kid at a 7-Eleven.
Okay. A lot of good discussion on this. Yeah, personally, I have a lot of thoughts on this. In the Bible, it says essentially do not drink wine to excess, I think. I'm paraphrasing, but there are also a lot of references in the Bible to drinking wine. So, morally, I don't see any problems with somebody utilizing this sort of substance for some therapeutic reason. What that is only determinable by the person using it, in my opinion. I certainly agree with the concept, though, that a child of age 14 or younger shouldn't probably be out there with the opportunity to make that decision for themselves. I do understand the pitfalls of the regulation component of all of this and the available resources to conduct that regulation. But I don't see that the blanket ban on this is fair. Again, I mean, understanding the complexities of the opioid epidemic in this country, and the number of different solutions people have thrown at that, not all of them are complete abstinence from drugs. And again, that's a personal choice, how somebody wants to improve their life. As long as there's an earnest effort to be made, I don't think we should stand in the way of that. And so if somebody is using this as an alternative to something that they deem to be more destructive, such as a classic opiate, and I'm not really going to disagree with that concept at all. So yeah, I struggle with this a lot. I don't like kids being exposed to danger. At the same time, I think adults should be able to make these decisions on their own. The adulterants in the products is an entirely separate issue, and I believe Ms. DeLugia has spoken to us about that, even in cannabis products, which all of that's extremely concerning to me. I mean, we're hearing about digestive problems from Taco Bell right now, and so all of these are bad things, and it's not necessarily just around somebody trying to go out and get obliterated on drugs, right? So this is complex, but yeah, I'm not one to seek an all-out ban right now. The other thing is, it appears to me that either the feds or the state is going to come up with a solution to this sooner than later. So if we step in and say, okay, there's an outright ban on all of these products, I believe that ban would actually supersede any of the other regulations that would be more permissive. So we may then, kind of be excluding people that other authorities deem to be responsible users of these products. So I would be inclined to do less than more right now, but I think we are looking for no motion this evening. So we got let off the hook. Thank you all for your time this evening. When do we want to bring this back, however?
Well, do we want to talk about what it looks like? Yeah.
Is that what you're seeking, Catherine?
I mean,
Direction.
My direction was, I mean, where I started this thing talking about the kids and that kind of stuff, and it is that, and I think we all, and it looks like we all kind of came to an agreement there that that's a large concern. And I believe in this state it's 21 for all the other items. I mean, you can't even get Sudafed without going behind the counter. I mean, so I think the direction for me is for sure 21 and older. And that's the only way you can buy it. You gotta be 21 and older. And I think the 7OH part of it's gonna take care of itself out in the next 30 days. I mean, we're not gonna have to be, am I right on that's what that was, a 7OH, you said August 6th?
Allison, would you, yeah, please.
I just want to be clear, does that mean is that a August 6th and it's off the rack?
My understanding is that the DEA gave 30-day notice to all manufacturers, distributors, individuals who sell or possess 7OH above a certain threshold, that they have an intent to schedule this. Now, the exact effective date, I mean, it could be the 5th, could be the 6th, could be 2 days later. I don't know the specifics on that. I can answer that question. But my understanding is they essentially put the entire industry on notice and said, you have 30 days.
Okay.
Any other questions? Yeah, of course.
Councilmember Graves, did you have a question?
I just had one maybe question for the chief, which is if we do enact a 21 and over ban, do you have any commentary on how we'd enforce that, you know, and what level of enforcement we would need?
Yeah, well, I alluded to it before. The more complex you make it to enforce, probably the less enforcement you're going to get, because essentially I'm going to have to take resources to do stings and do other things, certainly after the education period, et cetera. So, you know, someone alluded to the fireworks and whatnot. I mean, it's a similar piece. We can't go on people's property or violate curtilage. I mean, we can go on their property, but only parts of it. It's sold outside across the street from us, from city limits. And so, anytime you make it complex, it becomes hard. So, is it doable? To some degree, but to give you an example, if you make it a full ban, for example, a police officer going in to get a soda can look over and see if they're selling kratom, right? And now that officer can take whatever action is appropriate for the time, depending on the time period. To specialize it in any way is going to take then some sort of specialized enforcement action, if that makes sense.
Does make sense. Yeah. I mean, it seems like with a 21 ban, it's going to be, I mean, at minimum, I think that it would make sense to have some outreach to, businesses that are carrying it and selling it today, at least to try to, encourage them. And we'll have, fines associated with not complying, right? So encouraging them to follow the ordinance and ID folks that are trying to buy kratom products.
Yeah, I agree with Joel on that, and I think it would also be pertinent as if and when we do come to a ordinance that is acceptable and enforceable, that there's some public outreach other than just to the retailers, explaining our decision. Obviously, we're different than neighboring communities in our approach to this, so I think we should have some justification out there for the public to understand that as well. Councilmember Lombardi.
Yeah, thank you, Mayor. So just to follow up on Councilmember Graves' point. So I've worked in firework stands over the last few years. And one of the things that, well, for good causes. And when we would sell, we hand them a sheet that also, it's just like a safety sheet. And I think that that could be something that may be part of the ordinance. I'm not sure, but that maybe the retailer, every time they sell the kratom to somebody 21 years or older, they have a little thing, information about overusing it, and so forth. Certainly the alcohol industry has done that. They have various things on the packages, right? Because there's something to this whole thing here. Why the drug dealers and so are not getting into these markets when we have that 21-year ban. There's just not enough profit, I think, for them. And so, but we can also just take it a step further, I think, by maybe requiring the retailer to hand out something with each sale. Now that may sound like a burden, but it's a lot better than a total ban. So just something to consider. I'm not pushing it hard, but I think it's something that if they're going to use this product and they're an adult, using it, responsibly.
Or signage or something to that effect at the very least. Deputy Mayor Myers.
I was just going to say, we do have a ordinance proposed in here for an under 21 ban, and it seems pretty good. I don't know if anybody's had a chance to read it.
I did peruse some of that, yeah.
So, I mean, we do have the option, I believe, to take action tonight. We could make a motion to approve the under 21 ban, if anybody would so choose.
We've been telling the media that tonight you were not going to adopt anything, that you were just going to provide direction.
Okay.
And that this was a first reading.
I think it would be fair to use that maybe as a template or for staff to look at that a little further.
Okay. I think that's the direction we're going.
Okay. Looks like would like to see ordinance language surrounding 21 and older.
So bring that version back for the 28th.
Yep. We've always got to be a little bit different than everybody else.
Noted.
Thanks. All right. I think we've covered that topic pretty well. Does anybody have anything else to say? Okay, moving on to item number 8.
All right, we have to go to a hearing, but we wanted to share that with y'all because it was really, really good.
That's
Really
how it is done. Like last night when we were watching this, I'm telling y'all, roller coaster of emotions. It's like
Yeah.
we didn't know what was going to happen next.
Well,
you know?
and that one guy
Mhm.
questioning it turned everybody, it only takes one voice, and people start questioning, well, dude, he's got a point.
He had the balls to do that, and I applaud him so hard.
Yeah, like that's how discussion should go on city council hearings. So definitely top 5, I'd say.
That was amazing.
Yeah.
Okay, yeah, we have to head over to another hearing. So thank y'all for watching, and we will see you next time. We don't know when we're going to go live next. So, just hit the notification thing.